guys, good day. In today's video, we are going to tackle about healthcare waste management. We will instruct and demonstrate to you on how to properly dispose, segregate, and store waste. But before that, we're gonna inform you first what is healthcare waste, its management, so just relax and keep on watching.
What is exactly healthcare waste? According to WHO, healthcare waste are waste generated by healthcare activities. Includes a broad range of materials from used needles and sirens to sterile dressings, body parts, diagnostic samples, blood chemicals, pharmaceuticals, medical devices, and radioactive materials.
What is healthcare waste management? It measures to ensure the safe and environmentally sound management of healthcare waste. It can prevent adverse health and environmental impacts from such waste, including the unintended release of chemical or biological hazards, including drug-resistant in microorganisms, into the environment, thus protecting the health of patients, health workers, and general public. It also contains in detail safety procedures entered into the collection, handling, storage, transport, treatment, and disposal of healthcare waste.
Healthcare waste, there are some waste categories such as non-infectious like dry and wet waste, infectious waste, pathologic waste, pharmaceutical waste, chemical waste, pressurized containers, and radioactive waste. We need to segregate, dispose, and store each categories of waste.
Non-infection waste. It's waste that is not contaminated and does not cause a health risk. Not infection. Wet waste includes kitchen waste that are vegetables, cells, fruits, and leftovers. Foods and disposing this type of waste we need grain container for them to store. Before disposing with waste, it must to wear PPE socks, gloves, masks, and face shield. Going to show you on how to properly dispose the waste.
When the containers of wet waste are full, they should be placed in a garbage holding area to be collected by the piggery owner and used as animal feeds or to be composted and turned into an organic fertilizer.
Dry waste is composed of waste materials such as water bottles, glasses, cans, papers, and cartons. The storage of this type of waste is locked container. Label the container and disposing this waste. Make sure to wear your PPE.
After disposing the dry waste in the designated bin, place them in their garbage holding area for easy pickup of the junk shop dealer so that they can be recycled.
Infectious waste refuse capable of causing infectious disease. Items contaminated with blood, saliva, or other body substances, or those actually or potentially infected with pathogenic materials. Examples of this waste are waste contaminated with blood and other body fluids, like for example swabs, dressings, bandages, and disposable medical devices. Managing this kind of waste, we should have to be extra careful. Wearing PPE is necessary because it can impose threat to our health. They must be stored in a yellow container. Make sure to mark infectious waste with the international substance symbol. Then place them in the garbage holding area to be picked up by the municipal collection system. I'm going to show you on how to properly dispose the waste. Okay.
After disposing carefully the infectious waste in the yellow container, they must be sent in the treatment facility, and then the city collection system will collect the waste so that they will be discarded in the landfills.
Pathologic waste. This type of waste is defined as any human or animal body parts that include organs, body parts, tissues, surgical specimens and body fluids removed during surgery or autopsy. In disposing this type of waste, make sure to wear your PPE and the color of its container must be yellow and it should be labeled biohazardous because it belongs to this kind of category and it poses threat. Put them first in a garbage bag, then stored in a color-coded container or bin. I'm going to show you on how to properly dispose the waste.
The pathological wastes are transferred in the crematorium to be cremated, or they are refrigerated and then they are buried as their final disposal. The other way is that these wastes are placed in a treatment facility, then they are collected by the city collection system, and lastly they are recycled.
Waste is a subset of infectious waste and comprises syringe, needles, lancets, broken glass, and any other materials that can pierce the skin. We must put extra careful in disposing this type of waste because we might get punctured or if we careless. We should wear PPE. The garbage container to be used must be puncture-proof, like made of plastic or metal that's color coding for this type of waste. This type of waste is red and labeling is necessary. And now I am going to show you on how to properly dispose the waste.
After disposing the sharp waste in their puncture-proof container, the waste must be stored in their designated storage area to be sent in the treatment facility. The city collection system will then collect the waste to be placed in their final destination, which is the landfill. The other way for them to be disposed is burying.
Pharmaceutical waste is any waste that contains medicinal drugs that are expired, unused, contaminated, damaged, or no longer needed. It includes expired, unused, split, and contaminated pharmaceutical products, drugs, and vaccines that are no longer required and need to be disposed of appropriately. Masks, gloves, and tubings are also included to dispose this kind of waste. First, never forget to wear your PPE. Put them in a yellow container with label on it. Place them in a designated storage area. And now I am going to show you on how to properly dispose the waste.
After disposing the pharmaceutical waste in their container, the waste next destination is the storage area. The waste are delayed to decay, then the waste are collected by the supplier and also disposed by the supplier. Chemical waste. Waste containing chemical substances such as foam developer, disinfectants that are expired or no longer needed, and solvents. Waste with high content of heavy metals include batteries, broken thermometers, blood pressure, gauges, and etc. In managing this kind of waste, always wear your PPE because they are categorized as hazardous. They should be stored in a yellow container and then they should be marked for their identity. I'm going to show you guys on how to properly dispose this kind of waste. The waste will then be stored in their designated storage area if they are not hazardous liquid chemicals. They are then disposed in the sink, or the waste are delayed to decay to be sent in the treatment facility. Then after that, they are collected by the city collection system, and lastly, they are recycled. Pressurized container, a container designed to hold gases or liquids at a pressure substantially different from ambient pressure. Examples of these are aerosol, cans, gas cylinder, and gas capsule. Wear your PPE in disposing them, put them in a red container, and mark for identity. They should not be burned because they will explode. The pressurized canned waste must be stored in the storage area and then they are sent in the treatment facility to be crushed. They are disposed by the city collection system in the landfills.
Radioactive waste such as glassware contaminated with radioactive diagnostic material or radioactive waste includes liquid, gas, and solids contaminated with radionuclides. Those ionizing radiations have genotoxic effects. In dealing with this type of waste, being careful is needed because it is hazardous, which emits radioactive particles, which is not properly managed can be a risk to human health and the environment. Where PPE then stored them in an orange garbage, then it should be marked and labeled for identity.
After storing the radioactive waste in the orange container, these wastes are placed in the designated storage area, and then the wastes are now delayed to decay. After that, they are collected by the supplier and disposed also by the supplier. Advantages of good healthcare waste management. Easily and cost-effectively address healthcare workers' safety procedures, including reducing the risk of injuries, cut cycles of injection, dramatically reduce HIV/AIDS, sepsis, and hepatitis transmission from dirty needles and other improperly cleaned, disposed medical items. Avoid negative long-term effects like cancer from environmental release of toxic substances like mercury and dioxide. At its foundation, hospital waste management increases safety of employees and patients by reducing the potential of sharp injury along with the cost of direct and indirect treatment as a result. It also reduces the risk of exposure to blood-borne pathogens and reduces hospital-acquired infections.
For today, hope you guys attain knowledge about healthcare waste management, leaving you guys a saying that our responsibility in managing and disposing waste properly is needed to protect human health for the betterment of our environment. Goodbye and God bless.